This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Olli Tikkanen.
Welcome everyone. Before introducing guest of today's episode, I would like to note just a few things. Physical Activity Researcher podcast is committed to promoting equality and diversity in all its activities, including selection of guests. We have limited resources to scout all great researchers from different groups of people. So if you know someone who should be as a guest in the podcast, please ask this individual to contact us directly. As another thing, I would like to ask for your help. Being able to deliver this podcast to you, my audience, is based on how many people find, start to listen and follow this podcast. So I would really appreciate little help promoting this podcast. You can do this by subscribing, following the podcast on Twitter, retweeting tweets sometimes, and maybe even giving a good rating if you liked an episode. And now it is time for the actual show and introduction of our great guest of today's episode. Welcome everyone. I'm very excited about the guest of today's episode. I saw his tweet a few months back, asked if he would be interested being a guest, and now we managed to find time for this recording. We are going to be talking about PA promotion with whole systems approach and how to improve how we communicate physical activity guidelines to the public. So this should be very relevant for anyone working with PA promotion. Our guest has done his PhD at Leeds Beckett, linked to childhood weight management. He did his postdoc on the Public Health England Whole Systems Obesity Program. Currently, he is working as Senior Research Associate at University of Bristol. Ladies and gentlemen, I'm honored to introduce our guest, Dr. James Nobles. Welcome, James.
Hello, Ollie.
Yeah, so to start off with, could you tell us more about your personal and professional background?
Yeah, absolutely. I mean, I think you did a really nice job of summarizing it there beforehand. But just from a professional standpoint, I started working predominantly in the field of weight management about 10 years or so ago. So I was actually, it was called a weight management practitioner, and I worked for an organization called More Life. So that was all up in Leeds. And it was really on the back of that applied work that I started to get a little bit more interested in the research side of things. And I was lucky enough to secure a funded PhD opportunity at Leeds Beckett University. And one of the things that I wanted to explore within my PhD was how families engage within these weight management services, because we knew that services such as this are quite prone to high levels of attrition. And I think that's not just relevant from the point of view of weight management, that's also across the board. So my PhD was looking at some of those reasons for these high attrition rates and then trying to identify opportunities to improve those services in order to be able to increase the engagement throughout them. However, as much as I loved all of that research, I was very aware that it was quite focused on individuals. There's a lot of challenges, I think, as well within services such as those around health inequalities, because what we tend to find is that the people who may benefit most from those services are least likely to engage in them. Equally, if they do engage, they're the most likely to drop out of those services. So I was really quite keen to move a little bit away from, whilst keeping some of my roots involved in it, but to move away from these individually focused interventions to try looking more at sort of the systems in which we live. And that's, as you mentioned before, when I was able to do a postdoc on the Public Health England Whole Systems Obesity Program. And it was in that we were able to work over sort of a 3-year period with about 11 different local government authorities to really understand all of the different factors, if you like, which are situated around people that influence their health status. And so it's kind of born out of all of that I then developed this interest in systems approaches. And that's really then followed through right until the present time now. And hopefully we're able to talk a little bit more about that as we go in. And so, so I've then moved slightly away from the field of weight management and more into the field of physical activity, working with some brilliant people down at Bristol. But still very much keeping that focus around systems approaches. So some of the stuff we'll talk about today is a program called We Can Move, which is a whole systems approach to trying to increase physical activity across Gloucestershire. And then I've also done a little bit more, I guess, specific work at Bristol, which, as you said before, is looking at how we can improve how physical activity guidelines are communicated to the public, because the way in which they're developed and designed isn't that they're actually intended to be consumed, if you like, by the public. They're there for healthcare professionals. So we wanted to improve that as best we could and provide some recommendations for how to improve that communication.
And if we start with the systems approach, I think quite many people know it, but not all people are familiar with it. Could you give a short introduction to systems approach?
Yeah, sure. So I think there's lots of research now that's been coming out in the last sort of decade or so, which really suggests that a lot of non-communicable diseases, the high prevalence of physical activity, the high prevalence of, say, obesity, health inequalities more broadly, all of these things are the product of the places that we live, we grow up in, the people that we interact with, the jobs that we have, the places that we play. So there's all of these different factors that are influencing an outcome such as our physical activity status, or an outcome such as, for example, our weight status. So what a systems approach is trying to do is it's trying to understand what many of those different factors are, and it's then trying to identify places within this system to really intervene and change how that system works, which works around the individual. It's more of a population-based approach. So you're trying to identify these ways in which you can change how those systems work to really try and make them more conducive of supporting things such as a healthier weight environment or a more physically active environment. I guess that's the broad gist of a systems approach, but I think one of the things that differentiates it from some of the more traditional approaches within, I guess, health promotion is that it's trying to work with multiple different stakeholders from lots of different sectors. So this isn't anymore just seen as the responsibility primarily of public health teams, but it's trying to draw on the wider expertise of people who, in the context of physical activity, for example, people who might work in transport or who might work in planning, drawing on the expertise and the skills of the voluntary and community sector and seeing how they can effectively engage with communities more broadly. So it's trying to really harness all of the expertise, as I say, of those wider sectors to bring them all together and to identify ways in which, as I said beforehand, that they can then try to change how that system works. So we're moving away from these individually focused interventions, which predominantly try to change behavior, and we're trying to shift and intervene in these systems, which essentially create population level outcomes, such as these low levels of physical activity that we see around us today.
And as an idea, it sounds really good. How do you implement that? How have you succeeded in We Can Move project?
So I think it's worth me saying then that I am not an implementer of these whole systems approaches. One of the things that, just going back to the work that we did at Leeds Beckett University, the thing that we were commissioned to do by Public Health England was to create essentially like a guide and a set of resources that would enable these local government authorities to develop their own whole systems approach. And we developed that, as I said, over the course of about a 3-year period. And so whilst I'm not necessarily an implementer per se of these whole systems approaches, we have been involved in creating tools that enable local authorities and other organisations to be able to do those. So within the whole systems obesity work, we ended up pulling together, it was a 6-phased process, which went from the very outset, which was all to do with ensuring that local authorities have got the senior level support and the senior level buy-in in order to be able to actually really commit to something like a whole systems approach. But that support and that commitment isn't just coming from your director of public health, it's coming from say the heads of other services and the heads of other organizations. So you're trying to get this joint commitment right from the very outset that they do want to work better together in order to be able to work around a common outcome such as physical activity or obesity. And then there were like 5 other steps that followed within that process that enabled local authorities or organizations to develop these system approaches. I don't know if you want me to go through any of that, but I'm happy to talk very briefly through it if you like.
Yeah, please do.
So I guess what I've just talked about there then was sort of the first phase of this systems approach. But then some of the phases that followed on from that, within this second phase, it was trying to understand like what is being done at the moment. So from a local authority point of view or an organizational point of view, it might be looking at, okay, so who are the key stakeholders that we already work with around physical activity, or who are the key stakeholders that we work with around obesity? What's their role at the moment within the system? Like, what are they trying to achieve? So trying to understand what their key driving force are, if you like, because the idea is that you align efforts. So you're trying to create these mutually beneficial actions and endeavors over time, that it's not everybody's working to improve the environments around obesity, but you might have multiple different aims, if you like, that collectively can be worked together. So there's a really nice paper in the Lancet not too long since, which talked about the sort of syndemic of obesity, undernutrition, and climate change, and saying how lots of the actions that we might take forward in the future from a policy point of view might actually be able to really influence those 3 outcomes simultaneously. So just going back to the whole systems obesity process stuff. So it's understanding like what people are doing right now, understanding what their actions are, who the people are, what the assets might be, so on and so forth. And then beyond that, so the third phase was trying to enable a cross-section of stakeholders to map out what their system looks like. So to map out what their physical activity system looks like, or their obesogenic system looks like. And in doing that, you create these, and I'm sure everybody's seen them, you create these systems maps. And I think systems maps in the past may have received a little bit of stick in that they can look incredibly complex and highly overwhelming. But one of the key things I think in doing something like systems mapping is actually the systems mapping is an intervention in itself, because it helps to create these mindset shifts amongst individuals who attend these workshops, because they start to see that actually maybe they do have an opportunity to work with other organizations around say the physical activity system, and they see that it's no longer just about trying to get an individual to go do a physical activity session or getting an individual to have a healthier diet. Actually, what they start to see is that there's all these other factors that are influencing somebody's physical activity status or their weight status. And then beyond that, the 4th and 5th phases, they're really about trying to identify within that systems map and within that system, trying to identify these points within the system that they might be able to intervene. And we just actually submitted a paper not too long since, which is a tool that enables stakeholders to identify these different levels within the system that they might be able to want to intervene. And a lot of that aligns with the system science literature that's, I guess, historically been available around intervention level frameworks and the work of Donella Meadows and her 12 places to intervene within a system. So we've tried to simplify some of that system science theory into a tool that can be used, as I say, by stakeholders, by practitioners, by policymakers, rather than just being reliant on researchers. And then the final phases are all about seeing a systems approach as this continuously evolving thing, this continuously evolving entity, which needs to be reflected upon over time. And as it's reflected upon, then you can start to adapt your approach in order to the kind of the information, the data, and the learnings that you're seeing over time. And so that's the whole systems obesity process that has been outlined by Public Health England. And I think what we did see within that piece of work is that we worked with 11 local authorities to try and implement that. Many of them were able to work through that process, but actually it takes an awful lot of time to be able to set some of the key foundations up, such as the the key senior leadership buy-in. That takes a long time to do. Equally, it takes an awful long time to actually start to intervene within these systems in different places.
This podcast is sponsored by Fibion, a research device that has been shown to be valid in tracking sitting, standing, physical activity and energy expenditure. Furthermore, Fibion has been shown to be valid categorizing physical activity into light, moderate and vigorous intensity. In addition to scientific accuracy, Fibion provides automatically produced and easy-to-understand reports for research participants. Get scientific validation and learn more about Fibion at fibion.com/research. Fibion, from researchers to researchers.
And this was for obesity. Do you see it working the same way for physical activity promotion or any other similar thing?
Yeah, so the way in which this was positioned, I think this is why it's so relevant for this conversation today, is that process in a way will be quite useful for almost any complex, it doesn't even have to be a health outcome, just a complex outcome. So something such as physical activity, all of those steps that we talked about beforehand, if somebody is looking to adopt a systems approach, that process would absolutely be useful from that standpoint. And so what we've started to see is that organisations such as Active Gloucestershire and their approach, which is called We Can Move, they're starting to adopt elements of that whole systems obesity project. They're starting to adopt elements of that process in their local work around physical activity. So it's absolutely got application beyond, say, the topic around obesity. It was just that was, I suppose, what we were commissioned to orientate ourselves around.
Mm. And so it's 6 different phases, and you said that it takes awful lot of time, some of the phases. What do you see as the most challenging phases, and why is that?
I say it takes an awful long time. If I just put that in a bit more of the context, so we worked with, I think, 7 local authorities, and we were trying to kind of move through some of those, or at least get to the end phase within a 9-month time period. So it takes, I think it was on reflection, in working with those 7 local authorities, they said it would have been more beneficial to have more time in order to be able to work through those. So with regards to your question in terms of which elements might take a bit more time, as I said before, I think it's the amount of time that's required to, I suppose, get some of the initial buy-in from the wider sectors. And so it's all good and well that this might come from or be led by people in public health, but actually, in order to make a systems approach work, you need to have the really thorough buy-in and the commitment from those broader sectors. So investing a lot of time in relationship building and continuously, I guess, nurturing those relationships is something that's fundamental within any approach going forward. And I think that's the bit that does take a lot of time and a lot of continued energy in order to be able to do. So that's one aspect that takes time. And then the second one is probably around the actions or the interventions, if you like, that might come about because of a systems approach. Some of these actions, they might look very different to, say, your traditional public health interventions. So you might start to, I don't know, in a traditional public health mindset, you might be delivering these behavior change interventions. So like we all know about these kind of things like, I don't know, running initiatives or like Couch to 5K. What else have we got? Weight management services in the field of obesity. Like they're quite, I know there is a lot of time and energy that's required in setting those things up, but they're very easy to monitor, they're very easy to evaluate, they're very easy relatively to get funding for. But when you start thinking about actions within a system, there's not necessarily always an evidence base behind some of the actions that you might want to adopt. So just a good example of an action that might come from a systems approach is that you identify that you need to increase the cohesion between a whole host of different stakeholders working in your local area. Now, that is a really strong intervention because it's there to try and increase these relationships between key stakeholders that work within the system. But actually, it's very difficult to get funding for something like that. It's unlikely that you're going to be able to see, I don't know, a benefit in the levels of physical activity or the benefits in the levels of overweight and obesity because there are improved relationships between stakeholders. So it becomes really quite complicated when you're looking at actions within these systems. And so, yeah, that can take a bit of time to work through. And in order to keep the continued buy-in, as I said at the beginning.
And you have been doing this in this We Can Move project. What are the best take-home learnings from this project? What have you learned with the systems approach?
So We Can Move. That's it's a fairly recent piece of work. So I think it started out in 2015, and it's led by an organisation called Active Gloucestershire. But so they are an organisation that's very much trying to drive forward this systems approach around physical activity within that county. It was only a couple of years ago that, in fact, it was last April when they commissioned the University of Bristol. So I'm involved in this, Charlie Foster's involved, Sabby Redwood's involved, Russ Jago's involved, and they commissioned us to do this evaluation of the work that they're doing. And right from the very outset, one of the things that we weren't looking to measure, because this is, I guess, captured within some of the broader measures that Sport England undertake, we weren't expected to be monitoring the levels of the population prevalence of physical activity. We knew that was far too much of a distal outcome, and actually what we wanted to do was focus on more proximal things that might be changing. So what we were able to do within this evaluation of We Can Move is really, and I think this is what's quite novel, is develop some different evaluation methods to support the evaluation of We Can Move. So we did use some traditional approaches. So we are using, say, semi-structured interviews in order to understand the varied perspectives of all these different wider stakeholders that work within the system. But again, all of those semi-structured interviews, they are very much underpinned by like system science. So we're not just concerned with, say, looking at, I don't know, mechanisms to an outcome arising. We're concerned with looking at how does something like We Can Move, how does that promote you to change the way in which you think about a problem like physical activity, or how does this We Can Move project, how does that foster these relationships between different people in the stake within the system? So even within these traditional methods, we've tried to tweak them slightly. But I think some of the things that have been fairly exciting to do within this project are methods that we've used, such as social network analysis, this thing called ripple effect mapping, which I'll talk briefly about. And we've also used systems maps in a way in which we can start to, so we visualize what that system looks like, but then what we can do is start to overlay onto that systems maps the different places in which We Can Move is trying to intervene. And so it then becomes this active tool that enables them to continuously reflect on the approach that they're taking, to question whether or not they think that that's the right approach, and then to identify future opportunities to start intervening as well within the system in different places. So that's, again, a really core central part of the evaluation. Just to go back, if you want, to some of those other methods that I was talking about, like the ripple effect mapping.
Please do.
So we know that so it's quite difficult within a systems approach to almost predict what the interventions, if you like, are going to look like, and subsequently what some of those proximal outcomes also might look like. They don't necessarily have a predefined way of working. So there's a lot of these interventions that might, or interventional actions that might emerge from, say, a meeting that happens, or something along those lines. So what this method called ripple effect mapping enables us to do, it's a qualitative form of a outcome evaluation. And what it enables us to do is to understand all of the activities that have been undertaken, say, throughout the course of an 18-month period, and then working within these sort of participatory workshops that we facilitate, we're then able to speak with all these different stakeholders to try and understand what some of those wider impacts of being involved in this work has led to. So just to give you a really simple example, there's a bit of work in a very local area within Gloucestershire, and it's all to do with trying to, over a very long period of time, increase the opportunities for women, and particularly Muslim women, to be active within their local community. And so when we did this ripple effect mapping session with them, what we found is that there were a couple of these, say, multi-stakeholder events that happened within this intervention. And as a product of those workshops happening, as a product of those meetings happening with all these different stakeholders, they identified that the local leisure centre didn't really have any women's only sessions available, or they didn't have any opportunities for just women to, say, attend something like swimming. And so through this ripple effect mapping, what we're able to do is to almost see these wider impacts occur. So what happened was that a group of stakeholders, they went and met with this leisure service or this leisure provider. They had a conversation with them to really, I guess, open their eyes a little bit to some of the challenges that Muslim women might face in trying to access physical activity opportunities. And then what happens as a product of that was that they actually put a female lifeguard into post, and they started to run things such as female-only swimming sessions or female-only swimming classes. And so you can start to follow these wider impacts on and on and on. And that leisure centre then has been engaged throughout the last 12 months, and they've started to offer more and more of these women's only or female only physical activity sessions, which you wouldn't necessarily be able to capture that through more of a traditional outcome evaluation. And so that's what this ripple effect mapping enables us to do, is to see how something unfolds over time. And we can then look at how long does it take for these kind of things to occur? What are some of the wider benefits of that? Is there any financial benefits, for example? How many people are engaging within these different activities? So it really broadens the scope of an evaluation to start to capture some of these intended and unintended consequences that come about because of certain interventions. And I think it's been a really, really useful tool within this evaluation for us.
It sounds like a very, very interesting. So I will just recap, if I understood it correctly, that you will study the undertaken activities, actions within the project, and you will then have all different stakeholders, and you will be interviewing or discussing with them in participatory workshops, and then you learn that what changed, what kind of action had the change in different things.
Yeah, basically that's it. And but the nice thing about this, and it links in with, I suppose, some of the systems mapping stuff, is that you're visually documenting this type of data. So it's not just through interviews. It's you're working within these, let's say, small subgroups to almost draw out how, say, one thing led to another thing happening, and that led to another thing happening. And so you really build up these quite complex diagrams in a way of how these various different impacts occurred. And some of those impacts go far beyond, say, physical activity. They might start looking at, improvements in educational outcomes that a school may have observed because of an intervention that's been delivered within their setting. So you start to really demonstrate some of the wider outcomes that have come about because of these systems-based approaches.
Yeah, sounds really interesting. That was a good simple example. Could you tell an example which is a little bit of wider change, like maybe a little bit more complex example?
So I think this is where it does get quite interesting, and it then comes down to how people value certain outcomes. But we know that within, like, say, the system science literature, one of the most difficult things to change within a system are the attitudes and the beliefs of the people who make the system work in the way in which it does. And so, does that make sense? And so some of the key stakeholders then within, say, local authorities could, for example, be some of your councillors or your heads of different services, different departments. And so some of the things that we've been able to pick up through this ripple effect mapping is we have been able to evidence how these mindset shifts have started to come about in different organizations and in different councillors and in different, leaders within the local authorities. Because when you start to see those mindset shifts, occurring, and when I'm talking about these mindset shifts, I'm meaning that they're broadening the ways in which they think about physical activity and the things that may cause these low levels of physical inactivity. The low levels of activity to occur.
Yeah.
So you're starting to broaden the way in which they think about those problems, and you can then start to see these key leaders. They actually start talking to each other a little bit more, and then they might start to develop, I guess, a program between many of them, if that makes sense, which has a lot more power to change how that system works. And so good examples of this are, say, subgroups of these senior leaders coming together to just to work as a collective around the physical activity environment. I'm talking now in quite broad terms because these types of examples are a bit more abstract, and lots of things come out of these multi-stakeholder meetings, if you like, that you might not necessarily always link to physical activity. It might link more to a transport agenda, or it might link more to an environmental and climate change related agenda. But I'm just trying to think at the same time of like a good example, and I think at the moment that's slightly escaping me.
Yeah,
it'll come back to me, I'm sure, because there's lots of things have happened.
Yeah, no, I believe it. And and then in the notes you were saying about paradigmatic challenges within working with the systems approach. Could you tell more about those?
Yeah, I think it's, I guess, one of the simplest paradigmatic challenges that we have is around the level of evidence that might be required in order to get an intervention delivered. So in more of a traditional, again, and I'm talking about these terms like traditional public health mindset, and I'm very aware that these are changing all of the time, but in a traditional public health mindset, in order to be able to commission something like a weight management service or a physical activity session, they might want to see a very strong evidence base behind those certain interventions, because they're then able to go to whoever it is that's giving them the money and say, well, there's this really strong evidence to suggest that this intervention will lead to these outcomes. And that evidence, that when we look at like the hierarchy of evidence, they tend to be the gold standard of research in more of a medicalized sense is like a randomized controlled trial or a double-blind randomized controlled trial. And so a lot of the research funding, if you look at the big research funders that we have, a lot of research funding, and there's a really nice paper, I think it was in like 2016, which evaluated this. They saw that about 75% of public health research funding went into the evaluation of these really close like individual level behavior change interventions. And so if the vast majority of our research funding is going into pretty much these individual level behavior change interventions, then that is the only evidence base, if you like, that is going to be available for these policymakers and practitioners in order to be able to implement certain interventions. So when they start wanting to think a bit more differently about, say, different actions that they might want to implement, if they're held to this need for a really, really strong evidence base, and we know that evidence base is slightly skewed because of it's in favor of randomized controlled trials, then it becomes really, really difficult for them to build the case for these alternative types of interventions or actions, purely because they haven't got an evidence base available. Even if we look at population level, say, physical activity policies, it's really difficult to evaluate some of those population level policies through something like a randomized controlled trial. We might have to use something like a natural experiment, which in a research hierarchy doesn't always have the same weighting as something like a randomized controlled trial. So we've got these really quite complex challenges, I think, facing us, which ultimately have impacts upon the types of services that are delivered within local areas, or the types of things that are suggested we seek to change through policies. Does that make sense?
Yeah, that does make all the sense. I can clearly see that it's very difficult to make randomized controlled trials with complex interventions. So you cannot really design a study that would actually tease out the effect of certain part, or it will be really expensive. So I can follow that one. Do you see other challenges with working with the systems approach?
Yeah, but can I just going back to one of the things that one of the things
Yeah.
that you're just saying there, Ollie. There have been some really good studies done. So Australia in Victoria, they've done quite a lot of work around evaluating, say, systems approaches within certain districts of Victoria. But one of the difficulties within systems approaches is that they're going to look very different in every single place that they are implemented in. So even if you evaluate them through these highly controlled designs, so you might have a control district and then you've got your intervention district, which might be implementing a systems approach. Those systems approaches will look so different in all of the different places which they're implemented. Equally, I don't think we can understate the role of like the contextual factors within all of those different areas. So the starting point from which these systems approaches are being delivered will be very different depending on those areas that they are implemented in. So we might be able to use something like a stepped wedge design, or we might be able to use something like a cluster randomized controlled trial. They're extraordinarily expensive to do, and a lot of these systems-based approaches are actually implemented by practitioners and policymakers almost without some of the input, if you like, from researchers and academics. So it's trying to find a bit more of a balance, I think, and it's not research versus practice. I think it's how can research work better with practice and how can practice work better with research to evaluate some of these more natural interventions, if you like, that are being implemented, which I think a systems approach would sit within. Sorry, I went off on a bit of a tangent there, but I thought that was quite an important point to make.
Yeah, no problem at all.
This podcast is sponsored by Fibion. Fibion is an accurate sitting and physical activity tracking device and analysis platform. It is a great tool for projects that aim for behavior change in sedentary behavior and incidental physical activity. Fibion provides easy-to-understand PDF and web browser reports for participants. Other features include comparisons to recommendations, linking results to health risks, achievement cards, and interactive goal-setting tool. In addition, Fibion provides an API that allows for easy integration to other systems and applications. Learn more about Fibion at fibion.com/research. Fibion, from researchers to researchers.
So you said that the system approach results will look different in different places. Do you think we can find out some kind of trends that we can generalize between different regions, or do you think it's just totally different in each place we do this approach?
I think those approaches will be very different within different areas. However, some of the work that so Sport England, one of the governing bodies in the UK, they have commissioned, I think, 14 or 15 of these things that they're calling a local delivery pilot. So they are all across England. And that's basically a lot of money that's gone into these local areas to help them to implement a systems approach to physical activity. And I think through those kind of opportunities and some of the work that we're doing, then what we are able to do is there might be these outcome measures around physical activity that are taken over a long period of time. But if we have really solid process evaluations of these systems approaches, maybe drawing on some of the tools that I was talking about earlier, if we have these solid process evaluations, then I think what we are able to do is understand some of those key characteristics that enable some approaches to maybe work better than other approaches. So something that's coming out really strongly within this evaluation that we're doing of We Can Move at the moment is the fundamental importance of ensuring the community are very much at the heart of a lot of the work that is taken forward. So the community are involved in the development of ideas, they're involved in trying to understand how the system works, and they're involved in the actual implementation of these ideas going forward. That's something that's really key within this piece of work here. And I think when we start to draw on the learning from all these different areas now that are that are implementing systems approaches, I think we will then start to see some common trends, if you like, between how those approaches are being implemented.
Mm-hmm.
And all the time we have these more proximal outcomes that we might be looking at. So I think things such as looking at the results of social network analysis and understanding whether or not the relationships between these key people in the system, seeing whether or not those are improving over time, is just as important as some of those more longer term outcomes, which might include something like the population levels of physical activity. So we've got to be very mindful of how do we value the success of these systems approaches if we're acknowledging that, say, the outcome itself is the product of a highly complex system, and it may take something like, 10, 20, 30 years or so to really start to see a shift within. And we've seen that kind of happen within the field of smoking.
And you mentioned the social network analysis. Do you do that also with kind of discussions, or how do you build this kind of, how do you do this kind of analysis?
So we've drawn actually on a lot of the work that's been done in other countries around, say, evaluating systems approaches to childhood obesity intervention. So there's stuff in the States that's been done, stuff in, again, in Australia that's been done. So no, the way in which we have tried to understand these social networks is actually via a survey. So what you're able to do within these surveys is to understand, in a way, if you send this survey out to your key who you perceive to be your key stakeholders, you can then start to ask them, well, who are the other stakeholders that you work with, and how strong is your relationship with that person? Like, to what extent do you have mutually supportive goals that you're working to? Is physical activity something that's important to them? And so through these like multi-wave surveys, you're able to start building up a picture of who the key players are within the physical activity system. And equally, you can then start to understand, well, what happens if, say, individual over here, like this chief executive officer, what happens if that person there all of a sudden leaves his job or moves to another area? Then are the relationships between everybody else strong enough that approach can continue without somebody like him or her being involved?
Yeah, and about the systems approach utilization in different parts of the world, what do you see that which countries are leading the work utilizing the systems approach in different kind of health promotion?
I think, don't get me wrong, I think actually we're doing quite well. I think there's been a lot of, from a systems approach point of view, there's quite a lot of money and energy that has been invested within England around systems approaches, the development of tools and resources. But whenever I guess I'm writing like an introduction to a paper, a lot of the research that I would be citing is coming from the work that's been done in Australia, so through Deakin and Steve Allender's group. Equally, Boyd Swinburne over in New Zealand, they're doing an awful lot of good work trying to understand like the policy context and how the complexity of policy and the ways in which you might be able to intervene there. And also there's some really great work being done over in the States. So that's the kind of, that's the evidence, if you like, or the places that are doing quite a lot of this work at the moment. And I'm very sorry if I have missed out some areas that are also doing some great work. I'm just trying to think of them all.
Yeah, no problem. Probably you don't know all the countries how they are doing. That's probably understandable.
No. Yeah.
Do you have something before we move to this physical activity communication guidelines? Do you have something you would like to add for this systems approach discussion?
Not really. I think it's very much a growing area, and there's been an awful lot of interest developing in this area within the last few years. So I think it would very much benefit from a broader range of researchers and practitioners and policymakers actually engaging in this and bringing in some of their expertise. I think from just a research standpoint, there are so many methods that we would be able to draw on from a whole range of different disciplines that they're all available out there, but they haven't necessarily been applied in these contexts yet. So when I was talking before about the ripple effect mapping, that's something that's used quite often within more of consultancy-based organizations. So we had a look more broadly at what methods were being used, and we were trying to ask the question, like, what will help us to answer the research questions that we have around the evaluation of we can move. And that was one tool, if you like, that we saw that might help us to answer those questions. And we're then able to adapt and evolve these methods over time so that they become more fit for purpose. So I think there's an awful lot of work that can be done from a methodological standpoint within the evaluations of systems approaches. And that's where I think we can really draw on a lot of the expertise of maybe some of the people who are listening to this.
Yeah. And if somebody listening this now gets interested about systems approach, what kind of organizations you would like to collaborate, and what kind of collaboration would benefit you the most?
I think wherever we're able to learn from how other people are going about the evaluations of these approaches, I think that for me is one of the key things, is understanding what other people in other areas are doing and how they're adapting methods. That for me is a really useful thing that we could be doing. One of the areas that I think is really that I'd really like to see becoming more involved in these conversations is actually like health economists. And trying to understand the role that health economics may be able to play within something like the evaluation of systems approaches, and how do we start to not address is the wrong word, but how do we start to go into some of those conversations when we're questioned about, well, what's the return on investment of something like a systems approach? Like, to have some answers to some of those really key questions, I think would be very, very important, and drawing on some of the expertise of health economists in shaping those answers would be invaluable.
That makes all sense, and probably it's important to collaborate with different fields that we can find, like you said, that also the environmental things are important in active commute and so on. Thanks for joining us this week on Physical Activity Researcher Podcast. If you like the show, make sure you never miss an episode by subscribing or following the show on Twitter. This podcast is made possible by listeners like you. Thank you for your support. If you found value in the show, we would really appreciate a rating on Apple Podcasts or whichever app you're using. Or if you would, in a real old school way, simply tell a friend about the show. It would be a great help for us. We have a fantastic lineup of guests for forthcoming episodes, so be sure to tune in. Thank you all for your support and have a great day.